You know what they say, oral health is a window to your overall health, but 1 in 5 people are afraid to go to the dentist. Dentistry does not have to mean pain and discomfort. And here to discuss more with us is Dr. Bruce Lein. Good morning.
Good morning.
Thanks for being here.
My pleasure.
All right, so let's be honest. When people say you're going to the dentist, the first thing they think is it's equated with pain. Why is that?
Well, Olga, we are all products of our experiences.
This is true.
We have positive and we have negative. Yet when we go to a dental office in our adolescence and our youth, some of us and most of us had traumatic experiences, and that's it. Game over, the rest of their life, over.
That's it. But game over, rest of their life, but there are consequences for not going to the dentist, right?
Yeah, there are consequences.
And very serious ones.
Yeah, but you know what's interesting? We have 84% of our population, 6 to 18, see a dentist regularly. School systems mandate that.
Okay.
After that, it falls down to 60%. We have too many people not going to see a dentist. How about periodontal disease? You know about periodontal disease.
I do. It actually can cause a lot of problems, not only in your mouth, but in your overall health, correct?
Absolutely. And it's caused by this harmful bacteria that reside in your gums. And that's really a big problem.
And you can have cardiac problems, correct?
Yep, cardio, heart disease, and diabetes.
That's right.
And we can treat that.
And also just the common things like cavities can occur and things like that, but who wants those?
Well, you know what? I'd rather fill a small cavity than a big cavity.
There you go. I don't have any cavities, you know, knock on whatever, because I don't know, I think it's just DNA.
Well, then we call you boring.
I'll take it. Tell me about some advances in dentistry, because it's not what it was, 20, 30 years ago.
Number one, fluoride. When we put fluoride in our water, probably in the 1950s, game changer, so much less decay that we see in children, adolescents, and adults.
So many people benefited from that huge, dramatic change. But I want to make it clear, this is not bottled water.
Exactly, and that's one of my concerns, because the popularity of bottled water and the water filtration systems, they eliminate fluoride. So we're concerned that maybe we're going to have a reversal and we're going to see more decay. So if we do see that and you're using bottled water, you may want to consult with your dentist and discuss fluoride treatments or even fluoride vitamins.
All right, doctor, preventative dentistry can really eliminate lots of problems. So let's just talk about the basics.
Well, if you talk about fluoride being number one, the education that we give our patients on oral hygiene, number two. We use something called FBR, that's our protocol in the office. It's floss, brush, and rinse twice a day with a water pick.
Okay.
And flossing and brushing is great, but it doesn't do the whole job. That water pick is critical. And that's going to get rid of anything that's left caught in between the teeth and remove that harmful bacteria that causes periodontal disease.
Exactly, which we want to avoid. I've always heard go to the dentist twice a year. Does that still stand true?
Well, twice a year is for someone who has very little dentistry. But
the boring one?
You would be boring.
Okay.
But we have patients that come every 2 to 3 months just because if they have something, they want to catch it small.
I think it's also important to find a dentist that you can relate to. You seem to be very funny and open and warm, and I like that. And it makes it a better experience, a positive experience, right?
Absolutely. You come to our office, there's laughter, and everybody's having a good time, and everybody's more relaxed. And when you're relaxed, it's just a better environment.
And it's not as painful as it was before, right?
Well, today we can give an injection painlessly. I tell my patients I'm going to start by giving you an injection and you're not going to feel a thing. They look at me cross-eyed, but you know what? The nurses say to them, don't bet against them.
So you make it fun, which is fantastic.
Yes.
I see your patients behind you, they're smiling. And any final words of advice for those out there who are saying, I need to get to the dentist?
Run and go get that water pick. Use my FBR. Pick a dentist, and pick a dentist by word of mouth and from your friends. And then when you pick that dentist, see that dentist on a regular basis and your hygienist. And I guarantee you do all this, you're going to have one happy smile.
And for our viewers who want more information on you and they should be running to go see you, what's the website?
BruceLeinDDS.com.
Thank you so much for your time.
Thank you for having me.
Again, the website is BruceLeinDDS.com, or just check out our website, thebalancingAct.com.